The following segment is sponsored by PCI Plastic Surgery.
Welcome back to CBS 2 News at noon. It is time for Health Matters. Today we have Dr. Andrews from PCI Plastic Surgery to talk about bringing youth back into our face and our necks. Thanks for joining us, Dr. Andrews.
Thank you for having me.
So one of the things that you guys offer is skin resurfacing. Well, many things happen to do with skin resurfacing. What is that exactly?
So skin resurfacing is a way of removing the top layer of skin and allowing more youthful skin to develop after that skin is removed. There are three main categories. One is using a chemical, so a chemical peel. So essentially that exfoliates the top layer of skin, and then that's replaced by more youthful skin. The second would be dermabrasion. And essentially that's using a mechanical device, almost like a Dremel, right? And using that to sort of abrade the top layer of skin and allowing new skin to reform. And the last would be, what we're here to talk about today, is using lasers. So,
lasers, okay.
So laser uses heat to essentially vaporize the top layer of skin. And it can be a little bit safer and, quite frankly, more effective than some of those other treatments because it's tunable, as we say. So essentially, we can dial in certain settings and we can determine how deep we go, how much of the skin we actually treat. And so the laser that we have is something called the DEKA DOT fractional CO2 laser. And so this is a representative patient. So the before is on screen left. And she actually had a very nice result. These next patients are some other patients that we've treated in our office. So this first picture is of a patient who we treated her full face and around her mouth.
With this laser?
Yes, ma'am. So essentially.
So the next one after this?
Exactly. So it's great for folks who have those fine lines around the mouth, but also those deep folds sort of in her cheek. So we treated her cheek and we also treated her neck. Now this is one treatment.
That's one treatment.
One treatment, and certainly we can do more. So most patients, you know, with such extensive photo aging, 3 is typically what we like to do, about 6 weeks apart.
Now, is this something that they would always want to come back to do, like every couple years?
Absolutely, yeah. So the results last a couple of years. Certainly, people continue to age, but we do start them on a skin regimen as well. So that's very important. So retin-A's and that kind of thing. So this is a treatment of some vertical lines. A lot of folks don't like the vertical lines around.
Around the mouth there.
Yep. And so this is, and it's also a good adjunct to facelifts as well.
Oh yeah,
so
a little less
invasive.
scary,
Yeah, exactly. So sometimes with the facelift we can sort of pull, you know, the laxed skin laterally, but centrally we like to treat with some of these resurfacing procedures.
So who would be a candidate for these kind of procedures that you offer?
You know, anyone who has crepey skin, like around the eyes, anyone with deep folds, deep wrinkles, like I say, those vertical lines around the mouth. Is a good candidate. So usually people starting in their early 40s and that sort of thing, 50s. Certainly, like I say, it can be an adjunct to facelift as well.
All right, well, if you guys are interested, we've got the contact information here pulled up for you to contact Dr. Andrews at PCI. Maybe they can walk you through a little bit with it and what you're interested in. You can also look it up online if you want to see a little bit more about it. Thanks for coming in, Dr. Andrews.